HDI is a composite of all the following except life expectancy at 1 year, gender empowerment measures. False answer: life expectancy at birth, adult literacy rate, GNP per capita in US dollar. HDI is a composite of all the following except বলছে তার মানে উল্টা হবে। HDI 3 dimensions: life expectancy at birth, mean year of schooling, gross national income per capita. Life expectancy at birth, mean year of schooling, gross national income per capita. Primordial prevention is applicable for: true answer diabetes mellitus, stroke. False answer rabies, measles, accident. Social determinants of health are: true answer income, social gradient. False answer stress, culture, emotion. Social determinants of health: economic stability, health care, neighborhood environment, education, social and community context. Social determinants of health: economic stability, education, health care, social and community context, neighborhood and environment. নিশে দিয়ে মনে রাখা যায়, নিশি। An effective surveillance system includes ongoing collection of data, timely analysis of data. False answer specific case detection, adequate resources, efficient instrument. Surveillance includes correction, analysis, interpretation, distribution. Correction, analysis, interpretation, distribution. Social determinants of health: nishi, neighborhood environment, E, education, S, social and community context, E, economic stability, A, health care, E, economic stability. Case fatality rate represents case fatality rate represents: true answer killing power of a disease, extent of an epidemic, virulence of an organism. Killing power of a disease, extent of an epidemic, virulence of an organism. False answer survival chance of a disease, prevalence of a disease. Monitoring may be started by: true answer day to day watch, observation, following ongoing activities. False answer looking at the report mainly, tools of evaluation. Modes of intervention in secondary prevention are: true answer screening test, case finding program, adequate treatment. False answer disability limitation, vocational intervention. Primary prevention: health promotion, health education, environmental modification, nutritional intervention, lifestyle and behavioral changes. Henley specific protection, immunization, chemoprophylaxis, protection against accident, ICP. Secondary prevention: case finding measures, individual and mass screening, survey, surveillance technique, periodic examination, selective examination of people at high risk. Tertiary prevention: disability limitation, rehabilitation, medical, vocational, social, psychosocial, MSBP. Principles of community participation are: true answer trust, respect, responsiveness. False answer closeness, apartness. Community treatment can be done by: true answer immunization, promotion of water supply. False answer treatment of case, quarantine, clinical management. Community treatment can be done by: immunization, improvement of water supply, health education, health legislation, specific disease control. Immunization, improvement of water supply, health education, health legislation, specific disease control. Digital surveillance system requires skilled personnel, feedback, notification. False answer case definition field trial. Health promotion measures are true answer safe excretor disposal, health education, water disinfection. False answer vaccination, rehabilitation. Objectives of surveillance are true answer epidemic prediction, estimation of future disease impact. False answer epidemic detection, periodic health examination, health promotion. True answer epidemic prediction, estimation of future disease impact. False answer epidemic detection, periodic health examination, health promotion. Surveillance epidemiological, demographic, nutritional surveillance. Morbidity indicators include true answer incidence density, false answer disability rate, secondary attack rate, case fatality rate, risk difference. Morbidity indicators include incidence and prevalence, notification rate, attendance rate at outpatient department, health center, admission, readmission and discharge rate, duration of stay in hospital, spells of sickness or absence from work of school. Physical quality of life index PQL includes true answer infant mortality rate, life expectancy at age 1, literacy rate, false answer unemployment rate, dependency ratio. The PQLI components infant mortality, life expectancy at age 1, literacy, ILL. Case fatality rate represents true answer killing power of disease, incidence rate, virulence of the disease. False answer used in chronic disease, morbidity indicator. Hippocrates, true answer is a Greek physician, false answer is the father of occupational medicine, described about lead toxicity, devised a face mask made from animal bladder, noticed miner's disease. Hippocrates, father of modern science, modern medicine. Hippocrates, father of modern medicine, father of modern medicine, father of modern medicine. Disease under surveillance in Bangladesh are poliomyelitis, Nipah virus infection, dengue fever. False answer chickenpox, COPD. Disease under surveillance in Bangladesh, poliomyelitis, Nipah virus infection, dengue fever. False answer chickenpox, COPD. Objectives of surveillance are true answer prediction of epidemic, monitoring trends in endemic disease. False answer detection of epidemic, detection of pandemic, confirmation of endemic. Public health ethics is true answer population centered, focused on community people. False answer patient centered, focused on individual patient, concerned with the cure of patient. Ethical consideration, patient right, informed consent, patient rights to die, patient rights to live. Other controversial ethical issue, birth control, abortion. Public health law, registration of vital law, communicable disease control, food and drug control, medical education and health practice, public health, environmental health, social welfare. Tertiary level prevention includes rehabilitation, disability limitation, false answer chemoprophylaxis, health promotion, screening. Health promotion attained by true answer health education, nutritional intervention, environmental modification. False answer immunization, chemoprophylaxis. Health status indicators are true answer healthcare utilization rate, availability of hospital bed, morbidity rate, infant mortality rate. False answer accessibility to healthcare. Health status indicator low birth weight, nutritional status, psychological development of children, infant mortality rate, child mortality rate, life expectancy at birth, maternal mortality rate, disease specific mortality, morbidity, incidence and prevalence, disability prevalence. Indicators of physical quality of life index are infant mortality rate, life expectancy at age 1, literacy rate. False answer maternal mortality rate, neonatal mortality rate. Examples of community treatment includes true answer immunization, health education, improvement of water supply. False answer community clinic practice, postnatal care. Levels of community treatment, levels of action in community treatment at the level of individual, at the level of family, at the level of community. Example, improvement of water supply, immunization, health education, control of health education, health registration, control of a specific disease. Improvement of water supply, immunization, health education, health registration, control of a specific disease. Indicators for PQLI. Indicators of quality of life are: true answer infant mortality rate, life expectancy at the age of 0-1 year, literacy rate. False answer and level of unemployment per capita, GNP. Case fatality rate, true answer is less useful for chronic disease is the ratio of deaths to cases. False answer does not vary in different epidemics, is not related to virulence, always matches to crude death rate. Case fatality rate, true answer is less useful for chronic disease is the ratio of deaths to cases, does not false answer does not vary in different epidemic, is not related to virulence, always matches to crude death rate. Case fatality rate, the total number of deaths due to particular disease by total number of cases due to the same disease into 100. Primary prevention can be done by true answer health promotion, specific protection. False answer early diagnosis and treatment, disability limitation, rehabilitation. Tertiary level prevention includes true answer disability limitation, rehabilitation. False answer chemoprophylaxis, health promotion, social true answer tertiary. True answer tertiary level prevention includes disability limitation, rehabilitation, social intervention. False answer chemoprophylaxis, health promotion. New concept of prevention includes true answer primary prevention, primordial prevention, secondary prevention, tertiary prevention. False answer specific prevention. Magnitude of preventable mortality is indicated by true answer proportional mortality rate, life expectancy at birth, child mortality rate, infant mortality rate, proportional mortality rate, life expectancy at false. আচ্ছা ট্রু অ্যান্সার হচ্ছে ম্যাগনিটিউড অফ প্রিভেন্টেবল মর্টালিটি ইজ ইন্ডিকেটেড বাই, ম্যাগনিটিউড অফ প্রিভেন্টেবল মর্টালিটি ইজ ইন্ডিকেটেড বাই ট্রু অ্যান্সার প্রপোর্শনাল মর্টালিটি রেট, চাইল্ড মর্টালিটি রেট, ইনফ্যান্ট মর্টালিটি রেট। ফলস অ্যান্সার লাইফ এক্সপেক্টেন্সি অ্যাট বার্থ পার্ট অফ দ্য হোল মর্টালিটি। ট্রু অ্যান্সার proportional mortality rate, child mortality rate, infant mortality rate. False answer life expectancy at birth part of the whole mortality. Mortality indicator crude birth rate, case fatality rate, years of potential life lost. Is expectation of life, age specific death rate, infant mortality rate, child death rate, under 5 proportional mortality rate, under 5 proportionate mortality rate, adult mortality rate, maternal puerperal mortality rate, disease specific mortality rate, proportional mortality rate. Severity of illness is indicated by true answer attack rate, prevalence rate, incidence rate. False answer is case specific death rate, case fatality rate. Objectives of surveillance are true answer epidemic prediction, estimation of future disease impact. False answer epidemic detection, confirmation of endemic, periodic health examination. Indicators included in PQLI are true answer adult literacy rate, false answer per capita GNP, maternal mortality rate, under 5 child mortality rate, morbidity rate. Indicators included in PQLI are true answer adult literacy rate. Secondary prevention can be done by true answer early diagnosis, adequate treatment. False answer specific protection, disability limitation, health promotion. The following rates are morbidity indicators. True answer spell of sickness, hospital admission rate. False answer infant mortality rate, bed occupancy rate, population increase rate. Morbidity incidence and prevalence, notification rate, attendance rate at outpatient department, health center, admission, readmission and discharge rate, duration of stay in hospital, spell of sickness or absence from work or school. Objectives of surveillance are true answer epidemic prediction, estimation of future disease impact, monitoring disease trend. False answer sporadic detection, periodic health examination. Which of the following dimensions are not included in the definition of health according to the WHO? True answer occupational, medical. False answer mental, social, spiritual. WHO definition: health is a state of complete physical, mental, social well-being and not merely an absence of disease or infirmity. Health is a state of complete physical, mental, social well-being and not merely an absence of disease or infirmity. Which of the following dimensions are not included in the definition of health according to World Health Organization? True answer: occupational, medical. The false answer: mental, social, spiritual. এখানে স্পিরিচুয়ালটাও ট্রু হবে, ফিজিক্যাল, মেন্টাল, সোশ্যাল। মেন্টাল আর সোশ্যাল হচ্ছে ট্রু, আর স্পিরিচুয়াল এটা ফলস হবে। সরি, না, স্পিরিচুয়াল ট্রু হবে। অকুপেশনাল, মেডিকেল ট্রু, স্পিরিচুয়ালও ট্রু। মেন্টাল আর সোশ্যাল হচ্ছে ডেফিনেশনে আছে। An ideal health indicator should be: true answer: sensitive, reliable, feasible. False answer: universal, socially acceptable. Characteristics of indicator: valid, reliable, sensitive, specific, feasible, relevant. An ideal health indicator should be sensitive, reliable, feasible. False answer: universal, socially acceptable. Following are the hospital utilization indicators. True answer: hospital admission rate, bed occupancy rate, average length of stay. Hospital admission rate, bed occupancy rate, average length of stay. False answer: case fatality rate, infant mortality rate. Hospital utilization indicator: number of bed, number of admission, occupancy rate, average length of stay, total inpatient day, total outpatient day, total inpatient day, total outpatient day, emergency room visit, number of bed, number of admission, occupancy rate, average length of stay, total inpatient day, total outpatient day, emergency room visit. Following are the hospital utilization indicators. True answer: hospital admission rate, bed occupancy rate, average length of stay. False answer: case fatality rate, infant mortality rate. Hospital utilization indicators: number of bed, number of admission, occupancy rate, average length of stay, total inpatient day, total outpatient day, emergency room visit. Which of the following are considered as a primary prevention? True answer: immunization, risk reduction. False answer: screening program, early treatment, prevention of reoccurrence. Indicators of quality of life are: true answer: infant mortality, life expectancy at age 1, literacy. False answer: infant morbidity, maternal mortality. Changing concept of health include: true answer: ecological concept, psychosocial concept. False answer: spiritual concept, health promotion concept, health for all concept. Changing concept: biomedical, ecological, psychosocial, holistic. Following are the measures of morbidity. True answer: prevalence rate, incidence rate. False answer: growth rate, attack rate, crude birth rate. Sentinel surveillance indicates: true answer: identifying the missing cases. So some selected hospitals for surveillance in selected areas to report the cases of disease. Some selected hospitals for surveillance in selected areas to report the cases of disease. False answer: identifying high risk groups, surveillance for water pollution, surveillance of environmental control. মানে হচ্ছে মিসিং কেসগুলো আইডেন্টিফাই করবে, আর কিছু সিলেক্টেড হসপিটাল থাকবে ফর রিপোর্ট অফ কেসেস। কম্পোনেন্টস অফ ফিজিক্যাল কোয়ালিটি অফ লাইফ, ফিজিক্যাল কোয়ালিটি অফ লাইফ ইন্ডেক্স, ইনফ্যান্ট মর্টালিটি রেট, লিটারেসি। ফলস অ্যান্সার: লিমিটেশন অফ অ্যাক্টিভিটি, লিমিটেশন অফ মোবিলিটি, এক্সপেকটেশন অফ লাইফ অ্যাট বার্থ। কম্পোনেন্টস: ইনফ্যান্ট মর্টালিটি, লাইফ এক্সপেক্টেন্সি অ্যাট এজ 1, লিটারেসি। In Bangladesh, infant mortality 57, life expectancy at age 1 60, literacy 43, PQLI 53. Comprehensive health care means curative, preventive, promotive. False answer: interdependent behavior, people cooperative to satisfy their basic need. Criteria of comprehensive health care: preventive, curative, promotive health service, be close to the beneficiaries as possible. Has the widest cooperation between people, service and the profession, available to all irrespective of their ability to pay. Look after especially for the vulnerable and weaker sections of the community. Create and maintain a healthy environment both in homes as well as working places. Changing concepts in public health include disease control phase, health promotional phase, social engineering phase. False answer: primary health care disease, primary health care phase, human resource development phase. Changing concepts in public health: disease control phase, health promotional phase, social engineering phase, health for all phase. 80 থেকে 1920, 1920 থেকে 1960, 1960 থেকে 80, 1981 থেকে 2000. Changing concepts of health: biomedical concept, ecological concept, holistic concept. False answer: well-being concept, environmental concept. Changing concepts of health: biomedical, ecological, psychosocial, holistic. Human Development Index includes true answer: GNP per capita, adult literacy rate. False answer: life expectancy at age 1, infant mortality rate, maternal mortality rate. Morbidity indicators are true answer: incidence and prevalence rate, duration of stay in hospital, notification rate. False answer: crude death rate, per capita GNP. WHO recommended approaches for the primary prevention of chronic diseases are all answers are false. High risk strategy, early diagnosis and treatment, primordial prevention, population strategy, disability limitation. Examples of primary prevention are true answer: measles immunization, smoking cessation after heart attack, fluoridation of water supply. False answer: cervical cytology screening, breast self-examination. Health is considered as a perfect functioning of the body, multidimensional, central to the concept of quality of life. False answer: not an integral part of development, one that can be measured directly. Objectives of surveillance are epidemic prediction, estimation of future disease impact, disease burden estimation. False answer: epidemic detection, periodic health examination. Health promotion interventions are true answer: health education, lifestyle modification, environmental modification. False answer: health communication, disease prevention. Examples of tertiary prevention is true answer: early physiotherapy to an affected limb, laser therapy to prevent blindness in diabetes mellitus. False answer: vaccination against rabies, early treatment of persons with infectious disease, environmental sanitation. Health determinants are true answer: income, age, education. False answer: employment, genetic. Determinants of health: biological, behavioral, environmental, socio-economic, health system, socio-cultural, aging of the population, science and technology, information and communication, gender, equity and social justice, human right. Health: communities, societies, individual, families. Secondary prevention can be done by true answer: early diagnosis, adequate treatment. False answer: specific protection, disability limitation, health promotion. Morbidity measurement tools include true answer: incidence rate. False answer: attack rate, case fatality rate, child woman ratio, crude birth rate. CEA Winslow defined public health in 1920 as a science and art of promoting health, prolonging life. False answer: science and art of curating disease. Organized general effort for the sanitation of urban areas. Public health: the science and art of preventing disease, prolonging life, promoting health and efficiency through organized community efforts for the sanitation of the environment, the control of communicable infections, the education of the individual in personal hygiene, the organization of medical and nursing services for early diagnosis and preventive treatment of disease, and the development of social machinery to ensure for every individual standard of living adequate for the maintenance of health. So organizing these benefits as to enable every citizen to realize his birthright of health and longevity. Changing concepts of health: to answer true answer: ecological concept, psychological psychosocial হবে, এটা ফলস হবে। ইকোলজিক্যাল কনসেপ্ট আর হোলিস্টিক কনসেপ্ট হচ্ছে ট্রু। চেঞ্জিং কনসেপ্ট অফ হেলথ, ইকোলজিক্যাল আর হচ্ছে হোলিস্টিক কনসেপ্ট। আর আর বাকিগুলো হচ্ছে বায়ো, ফলস হবে বায়ো ইঞ্জিনিয়ারিং কনসেপ্ট, সাইকোলজিক্যাল কনসেপ্ট, ফিজিক্যাল অ্যান্ড মেন্টাল কনসেপ্ট। Main objectives of disease surveillance are: true answer epidemic prediction, estimation of future disease impact; false answer confirmation of endemic, epidemic detection, treatment of disease. The dimensions of health are: true answer physical, mental, social; false answer medical, physiological. Major dimension: physical, mental, social, spiritual; minor dimension: emotional, vocational, other, philosophical, cultural, socio-economic, educational, environmental, nutritional, curative, preventive.